Okay, very interesting. ARDS can be caused by pancreatitis. So if you have a hypoxic patient with a scary x-ray after a trauma, ask yourself, is the heart to blame or is it non-cardiogenic? And if it's non-cardiogenic, then the PCWP is going to be normal. So you can have acute respiratory distress syndrome caused by pancreatitis. So when you think of ARDS, that's acute respiratory distress syndrome, you think there are direct causes and indirect causes. Direct is like trauma, gastric aspiration, irritant chemicals just coming down the pipe, right? Or indirect is going to be like sepsis or pancreatitis, right? Either way, in the indirect, you'll have like insults that cause excessive cytokines to be released. Then your endothelial is going to like activate. You're going to have neutrophils. They're going to come to the scene. They're going to degranulate. They're going to release toxins. It's going to be horrible. This is going to worsen the. It'll cause endothelial injury, and that's going to have increased permeability to the capillaries in the lungs. And then they'll leak. They're going to leak and cause pulmonary edema. So pulmonary edema is not going to be normal. So in a question, they're going to ask you, hey, what's normal in this 34-year-old man with pancreatitis? And you're going to be like, well, it's not the capillary permeability, because that sure is going to be different. Not the lung compliance, it's going to be decreased. Why? Because of interstitial edema and hyaline membrane formation, right? So you're going to have a ventilation problem. So the compliance is going to change. Pulmonary capillary wedge, yeah, that's fine. That's non-cardiogenic. It's not going to change. Ventilation perfusion mismatch, yes, that's called physiological shunting. It leads to hypoxia. Even though you have adequate flow, the fluid-filled collapsed alveoli, what are they going to do? They're fluid-filled. It's not like they're going to be diffusing pretty well. So yeah, you got a ventilation perfusion mismatch. Work of breathing is going to be increased in ARDS, right? Because you have the fluid-filled alveoli. So it's going to be really hard. You have to do more work, right? So the compliance is going to change. The work of breathing is going to change. The shunting is going to change. The capillary permeability is going to change. But what's not going to change? The pulmonary capillary wedge pressure. Why? Because it's non-cardiogenic. It's caused by pancreatitis. Yep, that's pretty much all I got for you, folks. This is a good question.